Sure.
A very good afternoon and welcome to the session on the topic screening tests in gynecology cancers by our expert Dr. Swati Gogineni, consultant obstetrician and gynecologist in infertility management at Apollo Cradle and Children's Hospital, Jubilee Hills. We welcome you, ma'am. Also, I would like to tell my audience that, if you have any queries, any questions related to the topic, you can ask our doctor. She'll guide you through the session. Also, the questions she'll be taking by the last of the session, so don't miss out on any updates and details she has to give related to the topic. Also, stay tuned till the last to get the whole gist of our topic today. Now, I would like to hand over the session to my doctor. Doctor, you have the stage.
Yeah, thank you. Yeah, so good afternoon, everyone. I'm Dr. Swati Gogineni. I'm a consultant obstetrician and gynecologist at Apollo Cradle, Jubilee Hills. So I'm here to talk about screening tests in gynecological cancers. So I'll go one by one. First and foremost, I would like to talk about cervical cancer. So cervical cancer is actually very common among Indian women. So it's very important to get yourself checked and make use of the screening test. So cervical cancer is actually caused by an infection which is called human papilloma virus, and that is actually transmitted through intercourse. So it is sexually transmitted. So basically, it affects the cervix and it causes cancer. But not every person who harbors this virus actually, it results in cancer. So there are a number of precancerous stages also before it can actually turn into cancer. So the screening test available for cervical cancer is called as a pap smear test. And it's a very simple test. It is done by the gynecologist in the gynecological OP. And it is to be offered for all sexually active women. So usually starts at the age of 21, or if you are not married and not sexually active by the age of 21, you can start making use of these screening tests once you're married and sexually active. And it is done in the gynecological OP. The test hardly takes a minute or two, and we do it by the liquid-based cytology, and the report would be ready in about 3 days' time. So if it is reported as a completely normal smear, we don't leave it there. You have to still be under follow-up, and this test has to be repeated every 3 years. So in some centers, in addition to this, the routine pap smear test, what I told you about, we directly check for the human papilloma virus. So where the HPV testing is also done and it is normal, that is HPV is not detected, you can do the test once in 5 years. But in most of the places, we still offer the pap smear where we do the liquid-based cytology and not the HPV screening or HPV testing directly, in which case the test needs to be repeated every 3 years. So nothing to get scared of this test. It's just a simple speculum examination done by your gynecologist itself in the OPD, and it's not a very painful procedure. So there are so many people who actually don't want to get this test because of the fear of pain, or they think it's a very elaborate process. Like so many of them have knowledge about this test, but they just don't want to get it done because of they feel it's very painful. But it is not at all painful, just probably a little bit of discomfort, and it's a very simple test. So do make use of this opportunity, because this is a screening test. It can actually detect the precancerous cells or any abnormal cells before you actually land in symptoms. So we should not wait for us to develop symptoms of cervical cancer, which happens actually at a more advanced stage. So luckily, when there is a screening test available, I think you have to make the use of it. Now, coming to what can be the symptoms of cervical cancer. Yes, it usually results in some abnormal bleeding pattern. It can be either heavy bleeding during your periods or very irregular bleeding without any relationship to your periods. Sometimes a very foul smelling discharge, or it could be a postcoital bleeding, that is, you have bleeding after intercourse. So, if at all you have any of these symptoms, do visit the gynecologist immediately. But otherwise, make use of the screening test. Even if you don't have any of the symptoms, you might be just a normal, married, sexually active woman, but you still have to attend these screening tests, because there are a lot of there are a lot of benefits for these tests. And coming to the grading, of course, there are a number of precancerous lesions and the precancerous stages before it actually goes, and before it is being reported as a proper frank cervical cancer. So do make use of these tests. And when to stop testing is another big issue. So normally we recommend it according to the cancer screening guidelines, normally recommended till the age of 65 to 70 also. So we have to do it every 3 years. And what if you have undergone a uterus removal, hysterectomy during this process for some other purpose? So do you still need to continue testing or not? So if the hysterectomy was basically done for a benign condition, like say fibroid uterus or for some bleeding issue, nothing related to cancer, and if your smears were normal and the histopathology specimen, like that is the uterus which has gone for histopathology, has also come back normal without any sign of malignancy or any precancerous lesion, you could probably stop the screening there. But if the hysterectomy was done for a frank carcinoma, or if it was done for a precancerous lesion, always better to follow up the and to continue the screening techniques even after till the age of 65 to 70. But in that case, we don't take the smear from the cervix. Instead, we take the smear from the vault, that is from the vagina. Because sometimes, there could be recurrences of cancer, whatever cervical cancer, endometrial cancer, few years later might present with recurrences at the vault. Okay, so by doing the smear test from the vault, we can actually pick out if there are any abnormal cells seen there, so that we can actually diagnose the condition early before it actually worsens. Okay, so to sum up the cervical cancer screening, make use of the pap smear test, all sexually active women. So right from the age of 21 and or after the age of marriage and after you're sexually active, once in 3 years till the age of 65 to 70. And in case the 3 yearly intervals, what I told you is assuming that your previous smear reports are normal. If any of your previous smear reports are abnormal, depending on the severity, as I told you, there are a number of precancerous. It's not completely a normal smear one day directly turning into carcinoma on another day. So there are a number of stages actually. So depending on what stage, what grade the cells are behaving, the gynecologist and would of course call you much earlier. So you might have to come back for the smear every 6 months or every 1 year or sometimes every 3 months, or some additional treatment might be offered, and again after treatment follow up and repeat smears and biopsies may be needed depending on the report. So this is about cervical cancer. Now coming to uterine cancer, that is proper endometrial cancer. So unfortunately, there is no proper screening test actually for endometrial cancer. So how does a woman normally present with endometrial cancer? So mostly it is a slightly elderly woman who has completed her family, usually, but of course not always the rule, and the presence with some abnormal bleeding pattern. So again, heavy bleeding, irregular bleeding mostly, and sometimes even foul smelling discharge, and sometimes of course in more advanced stages other symptoms also. And when we order a transvaginal ultrasound, we actually find thickened endometrium. So endometrial thickness here is more important, and endometrial thickness is something that we cannot tell clinically, but we have to depend on the radiological diagnosis. So a simple ultrasound, especially a transvaginal ultrasound, is more sensitive than an ultrasound whole abdomen. So that tells us endometrial thickness, and it tells us if there is any other irregularity or any growth there. So any abnormalities on ultrasound actually warrants the need for hysteroscopy and a DNC. So olden days, before the laparoscopy and hysteroscopy actually came, it was only a blind DNC. So wherever we are suspecting, some carcinoma related changes, especially a woman presenting with irregular bleeding, it was only a blind DNC where we used to do a curettage, and whatever curettings, that is endometrial curettings were obtained, were actually sent for histopathological examination. But of course, in the present era, with hysteroscopy being available, hysteroscopies, we go in with a very slender telescope into the uterus. So it's not, you will not be given any scar. It is done under anesthesia where we actually inspect inside the uterus, and the abnormal suspicious areas, the thickened areas or any growth there can directly be biopsied, and it can be sent, because if we do a blind DNC, chance of actually missing the lesions is more. But when we do a hysteroscopy, it is directly done under vision, so we can visualize. We have a 360-degree view of the whole uterine cavity, and from the suspicious areas actually we can take a biopsy. So that actually will give us the histopathological diagnosis. So first of all, is it carcinoma or not, or is it any other? Again, there are a number of, sometimes a little bit precancerous, like going towards, we say atypia, like the endometrial cells don't look completely normal, but they have slight atypical changes. So this is important for us to actually plan our further management, because the management here doesn't just end with the hysteroscopy and the tissue diagnosis, but we might have to plan a more extensive surgery. Or sometimes it's only just a follow-up. Maybe we put them on some high-dose progestins and again review after a few days, a few months. or they might be needing a surgery most probably. So again, to what extent we have to do, whether it's a simple hysterectomy or a more radical hysterectomy, it depends on the tissue diagnosis of your hysteroscopy. So I think coming to endometrial cancer, it is mainly the ultrasound that plays an important role. And of course, before planning surgery, we would ask for more detailed radiological investigations like CT or of course MRI, which is much more superior to the ultrasound. And then, of course, prior to planning a proper definitive surgery, of course, doing a hysteroscopy and getting the tissue and sending it for histopathological examination is, I think, very, very important. So this is about endometrial cancer. And coming to the other cancer, the ovarian cancer. The unlucky part about ovarian cancer is that the woman present very late because it doesn't really have any typical symptoms. And in fact, to tell you, the bad part is that they don't present with any gynec symptoms. So that's why it's often missed and they don't visit the gynecologist on time. They just present with some vague abdominal discomfort, bloating, or indigestion, and just losing weight, just some abdominal fullness, and they don't really attribute it to a gynecological complaint, and they don't visit a gynecologist. And by the time they actually come to us, when we do a scan, it would be in an advanced stage. So that is the actual, disadvantage and the unlucky part of ovarian cancer. So there is no proper screening test or screening protocol in place for ovarian cancer, but I would just recommend yearly ultrasound, especially when there is a strong family history. Don't wait for any symptoms, just get an ultrasound done. And sometimes, yes, some of the screening tests include CA125, which is actually a tumor marker which is secreted by the ovarian tumors. But again, it is not very specific only for ovarian cancer. There are a number of conditions apart from malignancy. Sometimes in normal menstruating women, in pregnancy, in case of fibroids, pelvic inflammatory disease, endometriosis, so many conditions where it can be raised. Okay, so it is not very specific for cancer, but it is one of the tumor markers which is secreted by the ovarian tumors. So especially in high risk cases, probably we can make use of CA125. But I think annual ultrasounds will at least definitely help, at least to a certain extent, in making them come to us a little early rather than waiting for a more advanced stage. And coming to another cancer called the fallopian tube cancer. So this is actually a very rare cancer compared to cervical cancer, uterine cancer, ovarian cancer, and breast cancer. And here again, see, a typical symptom of this is like profuse watery discharge. So again, we are dealing with mostly an elderly woman, mostly postmenopausal, who presents with profuse watery discharge. So on examination, her cervix, vagina look absolutely healthy, and even on ultrasound, there might be some fluid collection inside her uterine cavity, but otherwise the uterine lining is unremarkable and her ovaries are fine. But actually, we are dealing with something in the tubes. So it is mainly again an ultrasound which probably gives us more suspicion, and based on ultrasound, probably have to investigate through an MRI also. But otherwise, there is no specific tumor marker or a specific screening tool for fallopian cancer. It is mostly only suspicion, and the ultimate diagnosis is only the histopathological examination of whatever sample we have sent after the surgery. So another important cancer I want to talk to you about is breast cancer. So breast cancer incidence is again increasing, and more so in Indian women. And see, previously it was only above the age of 40 or 50, but now unfortunately we see women even in their 20s and 30s suffering from breast cancer. And the incidence is actually increasing. Of course, genetics has a role to play here. And in addition to this, strong family history and delayed childbearing, too much of hormone intake, present day infertility practice. So all this actually puts them at risk for breast cancer. So one thing I want to educate here is about the self-examination of the breast. So every day, at least the woman should be taught to just palpate her own breast, probably while taking bath. And if she feels anything abnormal, if she feels lumpy, she feels there is some lump, or she has some sudden pain, or she notices any discharge, or she notices any skin changes, she has to visit the doctor immediately. So we have to educate the patients about the self-examination of the breast. And even we as gynecologists, when patients do visit us for some other gynec complaint, make it a point to start our examination with breast, because breast is a part of gynecology. And even if they present to us with some period related issues, I think just doing a per speculum and per vaginal examination is not right. Examination has to be detailed and should start, of course, from history taking and examination of the breast. So in addition, I mean, if we feel anything abnormal compared to the other breast, any lumpy feel or any definite lump palpable, or any discharge through the nipples, or any skin changes like retraction of the nipple or areola, I think the puckering is a word we use. They have to be sent to a breast surgeon, and definite investigations have to be done. So coming to the screening tests actually for breast cancer, we have the ultrasound called sonomammogram and mammogram. So sonomammogram is like the normal ultrasound, so doesn't usually involve any radiation, and can be done in younger women because the breast tissue in younger women is more denser. So usually we don't recommend mammograms before the age of 40. Okay, according to the previous guidelines, it was between the ages of 50 to 74 and to be done every 1 to 2 years. But now the age has further been reduced, probably because of the increased incidence of breast cancer, and it's just a little bit radiation, not much radiation exposure. So I think all women above the age of 40 can make use of mammogram every 1 to 2 years. And the sonomammogram can be done in the relatively less risk age group and in the younger population. And why mammogram is not recommended less than 40 is usually the sensitivity is less because the tissues are much more denser, so detection rate is a little less. And for women who are having a strong family history, a proper genetic testing also has to be done for the BRCA1 and BRCA2 genes. And of course, you should visit the breast surgeon here or an oncosurgeon. So they will do the proper genetic testing. And in case any of those come positive, you need to know how to plan, like, your family, finish your childbearing fast, and whether there's any role for prophylactic mastectomy. And sometimes, of course, ovarian cancers also come in this spectrum. So whether there's any role for, screening and treating the ovarian cancers before will actually be told to you. So I think to summarize my topic, first and foremost, proper screening test available is for cervical cancer. So all sexually active women should avail this opportunity to get themselves tested by the pap smear test once in 3 years. And please continue it till the age of 65 to 70. And if your smears are normal, do it every 3 years. If they are abnormal, yes, your gynecologist would tell you when next to appear for the test. And get annual ultrasounds done. If you are married, yes, transvaginal ultrasound, even if you don't have any issues, so that at least we can make sure your endometrium looks healthy. And even if there are any ovarian cysts or tumors, can be diagnosed early, so don't wait for symptoms to develop. And self-examination of breast at home is very, very important. And in case you palpate something abnormal or you feel it was not like that till recently and something different now, do visit the doctor. And when you come to a doctor also for any other gynec symptom, always your breast would be examined. And if there is anything abnormal, we would send either for a sonomammogram or a mammogram, depending, of course, on the findings and depending on your age, we would treat it. Okay, thank you. So I think if you have any doubts, you can just put up in the chat box so that I can clarify. So I don't have any messages in the chat box. I think so I made it very clear. Okay. So I think, yeah, so there are no questions. So hoping all of you understood, and my talk was very informative. So any clarifications or you want to meet me personally, please do come over to Apollo Cradle in Jubilee Hills. Thank you.